So next topic is emergency services. Those who have the textbook, it's on page number 198, emergency services. So emergency department of the hospital, it means a part of the hospital when a person is injured in road traffic accidents or those who are suffering from some serious complications. And in that complication, you require urgent, immediate treatment. So you will be taken to emergency department. Okay. So emergency department, it will work round the clock, 24 hours, 7 and 365 days. Emergency department is working. Okay. Anything that requires immediate diagnosis, urgent treatment for any illness that are in emergency nature, okay, injury from accidents, in life-saving situations, okay, it is treated in the emergency department. So definition of emergency department, emergency, the word meaning of emergency is defined as a condition determined clinically or considered by the patient or his relative or representative requiring immediate medical, dental, or allied services, failing which may result in loss of limb or life. Okay, so either it is actually a condition which is critical in nature, or sometimes the people consider it critical in nature. But once they come into the emergency department, things are pretty normal. Doctors may say it is very normal, it was not life-threatening, but they perceived it as life-threatening. And if immediate dental, medical, or allied services were not given, it could have led to loss of life or limb. Okay, so that is the definition of emergency. Functions of emergency department: to provide immediate life-saving medical care to the patients, to make sure you give emotional support to the patient and the relatives, because they are in a very anxious state. When you visit an emergency department, whoever is waiting for you outside, they are in a very anxious state. To take care of medical legal aspects, all the MLC cases are registered from the emergency department. Okay, communication with the media, especially in times of disasters, natural calamities. Okay, and education and training and research is also done if your emergency department comes within a premises of a medical college, okay, or a training institute or a research institute. Research and training work is also done in ER. To provide transport services, intramural and extramural, usually ambulance services are very close by, nearby to the emergency department. So types of emergency, you have, the surgeons have classified these categories. First emergency, that is what should be done immediately within the few minutes or within 1 hour, what you can do to save life. Second emergency, what must be done within the next 6 hours to save the life. Third emergency, what should be done within 24 hours to save life. Okay. Types of emergency services, major emergency services, general facilities like teaching and training hospitals, they are the ones who have big emergency department. Okay, 30 bedded, 40 bedded ER, big triad system is done. Okay, all the high-tech facilities and services are available. That is major emergency services. Basic emergency services is provided in all hospitals. 100 bedded, 50 bedded, 200, 250, 150 bedded hospitals. Everyone can have a basic emergency service. Then you have standby ER. That is usually your primary health center. First aid is provided. If they understand you require more treatment, they will refer you. They will take you to the nearby hospital. And referred emergency services, first aid is given and then you are referred. Same like standby ER. Physical facilities available in the emergency department: patient area, clinical area, administrative area, circulation area. Very similar to OPD. Okay, we'll discuss them in detail. Staffing. So in the patient area, same, you have reception, trolley bay, waiting areas for the attendants, VIP room. Okay, if you have a special VIP room nearby the emergency department, not compulsory. Space for security staff, ambulance drivers, coffee or snack bar, fax machine, PCO, pharmacy. Some hospitals have different pharmacy, separate pharmacy for ER cases. Coming to the clinical area, trauma care room, examination room and treatment room based on the consultations. Then triage area, that is important. When it comes to emergency department, triaging cases is important, segregating the patients, okay? Usually there are four triages: black, green, yellow, and red. Black is for dead bodies. Red is for critical care. Within 1 hour, you have to give them critical care. Yellow is like you can wait for 2 hours to give the care to the patient. Patient will not pass away. And green is ambulatory cases, patients who can take care of themselves, okay? So that comes under the triage care. And staff working areas, nursing section, emergency ward with adequate number of beds, storage area for drugs, linens, instruments, materials, toilets for patients, male, female, handicap, okay, janitor's closet, duty room for residents, house officer, interns, lockers for staff, seminar room, meeting room, room for anesthesiologist. Sometimes an emergency department comes under the Department of Anesthesiology along with ICU, okay? Along with ICU. Then in the administrative area, you will have casualty, accommodation for medical officer, duty officer, consultants, sister in charge or nurse in charge of the ER, deputy medical superintendent, medical in charge of emergency department, administration officer, assistant personal public relation officers or public relation officer office who are appointed for emergency department. In circulation area, again, it's the same: ramps, corridors, conveyor belts, okay, wheelchairs, trolley bay, okay, for the smooth movement of patients, staff, and visitors, and supplies provided. Coming to the staffing used in emergency department, medical manpower is there. Medical manpower consists of physicians, surgeons, orthopedic doctors, pediatricians, anesthesiologists, along with chief medical officer, interns, house officers, resident doctors, okay? They are available either full-time or on-call basis. Nursing staff, under the guidance of a qualified trained nurse, critical care nurses are posted here, who are certified in critical care nursing courses are posted here. Paramedical staff, ECG technician, OT technician, physiotherapist, lab technician, radiography graphers, okay, are required on full-time basis. Group D and C staff, ward boys, safai walas, attendants, chowkidars, drivers, security personnel, clerical staff, okay, for the smooth functioning of the emergency department. They are also posted here. Ambulances, every emergency department must have a good backup of ambulance services. For every 50 beds, you require one ambulance. Okay, based on Rao committee's guidelines, for every 50 beds, one ambulance should be provided. Okay. All life support equipments, including defibrillators, monitors, ventilator support system, all should be in working condition. On a daily basis, you should have a daily checklist, which will make sure that before you start your day, before you start the shift, make sure all these electric equipments are in working condition. Okay, it is not only for the movement of the patient with speed, but also with safety. That is important. Okay, the team must be, ER team must be well trained on how to use the materials and equipments for ambulance while transporting the patients. Policy. Record maintenance is the policy. You have to be very meticulous in record keeping, especially if you're dealing with medical legal cases. Okay. Maintenance of records, rendering care is rendering of care. Along with that, maintaining each record. If you have not recorded what care you have done, it's considered you have not given the care. Okay. Then you have referral policies, well laid down referral policy for admission and discharge for of referred cases to a higher center, or sometimes reference is done to a lower center as well for continuance of treatment and follow-ups. For medical legal cases, it's important that you start the treatment as soon as the case comes. Okay, save the life of the patient. That is important. Along with that, simultaneously, a police officer, with the help of other aides in the ER, police officer or law enforcement officers should be informed. And in case if you require a dying declaration by the patient, a magistrate has to be informed. And if the magistrate delays in arriving, it can be recorded by the treating doctor also in an emergency situation, which can be passed on to the magistrate later. Then you have disaster preparedness policy. So you should have a well-planned and well-rehearsed triage system, disaster plan. Okay. Emergency department is expected to play a very critical role in disaster planning along with MRD. Okay. First step is activating a disaster management code yellow. Even the duty officer is empowered to activate the plan. Well-defined trial system should be there to sort and segregate the patients based on their medical requirements. Then you have the code blue procedure used to announce any emergency or serious cases like cardiac arrest or any emergency code blue situation. Whoever is the duty doctor in that floor available in that area will rush to the patient. When you announce the code blue, you have to announce the floor bed number as well. Okay, so directly the duty doctors can rush to that place. Then you have medical audit. It's a very important tool in evaluation of emergency services. So the following things can be ascertained if you are doing a medical audit: completeness and adequacy as well as accuracy of the records. Okay, how complete the medical records are, how adequate it is, and how accurate it is. Okay, correctness and substantiation of the diagnosis. Okay, how correct is a diagnosis? Did you make any mistake in diagnosis? Okay, did the doctors make any mistake in diagnosis? On what basis this diagnosis was declared? Okay, so that is correctness and substantiation of diagnosis. Errors in diagnosis and management. Sometimes doctors are also humans. They make mistake. They misjudge the condition. Okay, so errors in diagnosis and management. What all things went wrong in management, that can be understood so that it can be prevented next time. Cases of complications which were admitted with certain symptoms, but the symptoms got aggravated after being admitted. Okay, that is complications. Cases of death, quality of record maintenance. Okay, is it signed properly? Registration number of doctors, if it is mentioned properly. Timely record fulfillment is done or not. Investigations which could be avoided or were indicated could not be done. Okay, some investigations which are not necessary, but you are still doing it. Okay, so that has to be avoided. You don't want to increase the medical expense of the patient. And some medical and some areas where investigation was indicated to be done, but maybe the doctor forgot or the nurse forgot to send the patient samples. Okay, and that led to complications. So these things can be ascertained when you're doing a medical audit. Grievance redressal system, have a proper grievance redressal system. Each and every grievances should be addressed, should be replied back. Feedback has to be given. Okay, it's a consumer's right. Patients and visitors are considered as consumers in a healthcare industry. So under the CPA Act, Consumer Protection Act, they have the right to be redressed for their grievances, and also according to the Right to Information Act as well. A person who is from an appropriate status must be designated as a public information officer, and through them, the redressal proceedings can be carried out without any delay. Managerial issues in emergency department is not mentioned in textbook, in this new textbook. You can check it online if you wish to. Okay, so that's all for today's session.